Hello, I am Jan Reardon, and I am representing the Jennifer Reardon Foundation, and I have a guest with me today that I will tell you a little bit about in a minute. Just wanted to let you know that the foundation has been formed for my sister-in-law, Jennifer Reardon, who we lost to a tragic accident a few years back, and my brother has formed this fabulous foundation that has pillars to represent the areas that were such a focus of Jen's, and that would be women's empowerment, community vitality, early childhood education, and financial literacy. And along with that, in the foundation, Jen's mantra was to be kind, loving, caring, and sharing, and that's what it's all about. Every act has been a true act of kindness. We have a huge announcement to make next week in Albuquerque to honor Jen by the number of acts of kindness that have been logged in, and really putting Albuquerque on the map to be one of the kindest cities in the United States. But here we are in Vermont, and I have the absolute pleasure and honor to introduce Kimberly Pierce, who is a physician's assistant in Plainfield, Vermont, central Vermont area. And just, I hope we have enough time to listen to Kimberly about the Kindness Project that she's involved in and what she really has to offer to us in regard to what's tangible to be able to bring change to the healthcare system and move forward in a much kinder way. So let me introduce you to Kimberly Pierce, and good morning to you.
Don't forget about Bruno.
I know, I was going to give that honor to you. He's becoming my best friend, but I wanted you to introduce your special friend to us, please.
Yes, this is Bruno the dog, who's here for fun and for support. So.
And I love his purple scarf, and thank you for wearing purple. I know obviously that was Jen's color, and as well as your friend.
Yes.
That you can talk about as well. But please begin by, saying how you're feeling about being here, and then talking a little bit about the Kindness Project to get things started.
Sure. Thank you so much for having me. I'm so honored.
Thank you.
I feel like my life has been leading up to this moment.
Love it. Just love it. Thank you for your time, Kimberly. I know how busy you are.
And I just want to take a second to recognize that we here in Vermont are actually here on unceded Abenaki territory, and I just want to honor that.
Love that. I love that.
Yeah.
And which is such a wonderful tie to Albuquerque too.
Right.
I think of you when I'm out there, so that's beautiful.
I just want to dedicate the next half an hour to my niece.
Absolutely.
Thank you.
Consider it done. Okay, so if you could just begin, we'll just chat about, I know there's so many different things that I love hearing about, and I would love to share, obviously, with the community, but let's just talk about the Kindness Project, because when I was able to obviously host the show, I went on to Google and put Kindness Vermont. You popped right up, picture, and I reached out to you, and thankfully you were back in touch that night, and the rest is history. Here we are.
Yeah.
So that was very exciting for me to see what had been taking place, because I was not aware of that, and obviously being kindness related, I was all about that and being able to find out what you've done and what the next steps are. So if you could just talk about the project, that would be fabulous.
Thank you. We were waiting for you.
Thanks.
Yes. So the Vermont Kindness Project came out of, I've been working as a medical provider for the last, actually, really long time, since 1987.
Thank you for that.
Thank you. Yes. And I've actually been in the same practice. And what I found is there has just, since the opiate crisis hit, probably, I don't know, whenever that was, 10 years or so ago, I just found that I was feeling very much in despair and hopeless about what I could do for my patients. And
Beautiful.
I could love them up in the exam room, but then I send them out to a system that is really broken. And so the Vermont Kindness Project, if you can think of it as everything that can happen outside the exam room, it's really more for community and convening, and also thinking about healing and reducing stress in ways that we've never thought of, like tapping into creative pursuits, and think about yoga and meditation and pet therapy and walking labyrinth and those kinds of things, and trying to get a place, a resource for my patients, so they'll be able to find some resources, learn some more about the topic we're going to talk about today, and find some some things that they can do.
Perfect. And my understanding, and maybe you can expand upon this a little bit more, is that Vermont is leading the way. There's no question about that, as far as taking this step forward to create a pilot program in Vermont that would be nationwide in our lifetimes, which is fabulous to know that we'll be able to see this through. But what would you say, from your perspective, has been the biggest obstacle? I know there's so many, but you, obviously, in the trenches, you can prioritize. What is the biggest obstacle to this point that has not allowed this to move forward at a little bit faster pace? I mean, I know what's involved, so it takes time, but we've struggled with healthcare for so long, and so this is just fabulous news. But what's holding you back at this point?
Well, nothing's holding us back at this point.
Good. Okay.
And we're about to unleash, and I'm very proud to say that Vermont is going to lead the way in becoming the first, I'd like to say, the first trauma-informed state and race-informed state.
Okay. And when you say, Kimberly, just because we've had a chance to talk, so I'm starting to get a little bit of the language, but what does trauma-informed mean in your practice?
And that's a great question, and we're still trying to actually learn what the meaning of that means. And I don't want to scare anybody off by trauma-informed, but the easiest way to distill it is just to imagine the lens of looking at a puppy or looking at a baby on the floor, and like how we feel a certain way. We feel joy. We feel
lightness. We're light.
Yeah, there's a word for verklempt, right? And we feel that kind of joy. Natural. Yeah, it's actually it's a physiologic state, and so what we're trying to do through education and empowerment is to stop the intergenerational cycles of violence. That when all you know is a violent family, then that's all you're gonna know what to do. You don't know and
respond differently. Right.
So trauma-informed is a lens from which we can look at a person, and it's really through, instead of a fear-based lens, it's really a lens of love. And how can I, as a practitioner sitting there in an exam room with a patient who's struggling, who maybe they're homeless, maybe they're dealing with addictions, how can I imagine not only where they came from today, but what happened in their ancestry, what happened to them as children, what happened to their grandparents, and where are they going to be going? So looking at the whole well-being of the physical, the emotional, and spiritual well-being, which is, I'm afraid, and I'm honestly, I'm ashamed that the medical establishment has sort of cut off spirituality as something that's actually important, when that's exactly what we're missing right now.
Exactly, right. That can certainly bring everything together. So what would that look like for you going into work tomorrow with a trauma-informed center, and how would you treat that patient? Well, I know what you're already doing, so I shouldn't use you as an example, but how would another provider, either in your clinic or elsewhere, act when a patient came in versus their normal routine? What would be the tangible difference?
So this is the exciting thing, and we didn't really talk about what this project is going to be at the health center in Plainfield where I've been working. We're going to be, and let me just take a step back to say that there are about 1,600 federally qualified health centers in the United States.
Okay.
There's about 12 in Vermont. We believe we're going to be the first health center in Vermont, and maybe of the whole U.S. that's going to be what I call trauma and race informed. Right. And so what that's going to look like is the whole organization gets trained up about the importance of understanding and reflecting on our own things and our own traumas so that we can be our best moving forward. Right. And so that would mean that what we're hoping to capture, and we actually have a research study with 5 colleges from the University of Vermont, and I'll just say the College of Medicine, this College of Public Health, the School of Business, the School of Nursing, and the School of Education are actually coming together at the table, try to create a pre and post survey so that we can actually measure what we know is going to happen. And what I hope is going to happen is that when patients come in the door, they're going to be greeted by a different vibe.
Exactly. You
of
can feel the
kindness.
culture shift.
And if you realize that we're all on a spectrum, there's the autism spectrum, but there's also kindness spectrums. There's trauma-informed. There's so many.
Good point.
And so if we could all just come up a couple of notches, then I think that would be palpable. And I hope that that will also translate into better outcomes for patients. And that's just the beginning.
Right, and that's fairly recent, as you say, with UVM, with the 5 colleges coming on
Yes.
board.
The training, we just got the dates today. It's going to be in February. And
Congratulations.
Thank you.
Oh,
yeah,
boy,
it's
that
really exciting.
Yeah, it
and
sure is. I mean, it's a movement. It is truly a movement.
And we're hoping that we're actually going to film it as it's happening so that we can be a model for other places and to be able to say, this is not rocket science. It is brain science, but it's not
Good point,
rocket
right.
science. And it's really, it's doable.
And it's who all of us are at the core. You talk about that baby or that puppy, and they come in with this clean slate, as we all do.
Yes.
For the most part. Things happen, and obviously we have to deal with that, but again, it's how we get through those things. And I can certainly look to my brother in the trauma that has come, for their children and family and friends, and how you need to be very aware of ways to get through, such as spreading the mantra of Jen's kind, loving, caring, sharing, keeping that spirit alive, and focusing in on the positive, which would be the conversations that you're having in your office to discover what could be going on in somebody's life that they're ashamed or embarrassed to talk about. Meanwhile, you bring that out, and there's no judgment. Why should there be? We should all be at our core supporting one another. And I think there's more people out there that would like to do that, but just don't even know how simple it could be.
Yes, and you asked me about obstacles, and I really didn't answer that question, but I think the system right now is set up to be a for-profit industry.
Absolutely.
So if we want to change that,
So it's all about time, right?
it's
and efficiency.
about time.
Yeah.
It's about checking the correct boxes and ordering
Old protocols.
old things that don't take into account this very, very powerful public health study that was done, the ACE study, which is what is now.
And what does ACE stand for?
So Adverse Childhood Experiences, ACEs, was a study that was done in the mid-1990s, a long time ago, and it was the biggest public health study that's ever been done of its kind, even to date.
To date.
And what it showed was just stunning. Nobody could believe it. The amount of trauma that this population, the 17,000, mostly white, mostly well-educated and very well-insured population had, was so surprising. And we had no idea that it was so common. But what we also didn't know is that stress in childhood imprints in our bodies in a physiologic way. It's not just that, oh, okay, you had a lot of stress and then therefore you're making bad decisions.
Right, right.
What I'd like for people to understand about ACEs is kind of think about it as like a lead level, right? If you're exposed to lead as a child and you have a high level, we don't usually blame those kids because they can't control what their environment is like, right? So a lead level is an environmental toxin.
Right.
That imprints in our bodies in a physiologic, measurable way.
Right. That's the difference. I think it's measurable.
And so is ACEs. So is stress in childhood.
Yes.
Stress in childhood is basically so intense because of the sponge that we are as children soaking up. And if our bodies are in a state of hyperarousal or fight or flight, which is understandable if you're in a lot of stress, it's actually an adaptive mechanism that is absolutely, probably keeps you alive.
Exactly.
It lets you leap a tall building or something, right?
Right.
But if that stress doesn't ever come down, that cortisol, the adrenaline, all of those physiologic changes actually imprint in our bodies and increase the risk of disease.
Exactly.
But the exciting thing, and this is what people aren't talking about, because I think that they get so like, oh, it's just such a bummer. Like, why would you be excited about this? Well, I'm excited about it because now we have the research on the flip side, on the light side. We've got the dark side.
Exactly.
We've got the light side, which shows us that neuroplasticity and resilience is something that can be taught. It's not something that's inherent, that we can all become more resilient and we can all heal no matter what age you are.
That's amazing. And I'd love to talk about that a little bit more. So what would be an example of that? Say you do have, a child or really anybody that comes into your office that has dealt and has been dealing with a great deal of trauma. What is that kind of approach? Do you go to, I know you make home visits, which is fabulous to be able to do that in this day and age, but how do you get to a place with that person where there is some sustainability on a kinder environment and culture for them?
That's such a great question. To me, I think it is using, when I think about trying to talk to a patient about their stress in childhood, I have to empty myself.
Sure.
And I have to be completely, fully present and ready to receive what I'm about to hear.
Exactly.
And some days I'm not up for it, and I can't do it. But if I am, then what I find is that by bearing witness, we can transform trauma into healing. And that's just about showing up and being aware, being acknowledging, and not just being, oh yeah, okay, you have the score, have a great day.
Exactly,
it's like,
right. Put it in the file and move on.
Oh my God,
right.
I had no idea.
That's more of a disservice to know and not be able to respond and react accordingly.
And the medical system has always been like, okay, well, if this is a psychiatric kind of thing, then that's for DCF, or that's for, mental health, that's for psychiatry. And in fact, primary care is the place we need to be entering this and starting conversations about mental health. Because I have been at the health center now and taking care of the same families since 1987. And we tried to actually estimate how many patients I might have seen, and I think it was something like 15,000 people over my time there, and I'm still there, and what that allows me is an aerial view and to be able to see people in an individual basis, but also through families and also community, and I think going back to sort of the old days where there was a doctor that was doing house calls, who knew you,
more of the dynamic of that family, right?
Who just wanted to, who wasn't a stranger. That, to me is like a shift toward away from being a medical provider and toward being more of a healer.
Exactly, right.
So how can we be more healing? Well, that means that we're not judging you.
Number one.
On any level.
Right.
And even if I'm smiling and I'm being professional, but inside I'm thinking, what is wrong with this person? Why can't they just stop? Whatever it is, ... If you're thinking those things, even on some level,
it comes across. Right, there's a vibe there, and when someone's pure or when they're not.
And it breaks my heart.
Exactly.
Because somebody who's been traumatized, I feel like, there's a starting line, right? There's a starting line in life, whether we call it kindergarten or whatever, and you want everybody to be here.
Yes.
Maybe you've had good food and you've been taught some things in school, and away from school, and then you show up. But people who've had trauma, literally, if the starting line here, they're under the ground.
Exactly, right. They're not even showing up.
It's not, and how do we acknowledge that some people are here, some people are here. They're already ahead because of our own white privilege or whatever it is.
Right.
And so I want to say, for all those people, and this is what I try to do, is if you were down here, I'm gonna put you up here for a minute.
Right.
And I just want to say, you're amazing, you're incredible. What happened to you was not your fault. You are a survivor. I am so impressed. Like, the fact you even got here today.
Exactly,
I can't imagine what people go through.
Right, to recognize that.
Having that true empathy, and I don't see that it's an us or them. For me, it's
here we are.
We are united, and that's the basis of all spiritual health, right? Is that we are connected.
Right, and we care about one another.
Right, and if we don't, and somebody in our community is and if they are suffering, so are we.
Absolutely, and talk about community vitality. What a way to transform a community, no less, at every level, whether it's in, obviously healthcare. I also, love to think about the different things that can be done in the school system, the workplace, through the community with rec centers and gathering places. There's so much opportunity to be able to level that play field in the sense of people showing up and being glad to be there, even if it's for 1 hour out of that day today. Maybe tomorrow it's an hour and 10 minutes where they're feeling at peace, but just to bring peace into their life. And I remember when we first met, you had different phrases and different ways, and I think these are nice, tangible things for me, even as a friend or a family member or coworker, to be able to. I don't think we realize sometimes when we say something, one, the tone, or secondly, the words, we might have a nice message, but it comes out differently. So can you give us those examples of how to word something in a better way?
Sure. And I think tone and posture matters so much.
Absolutely.
So much. And voice matters so much, and we don't talk about that. But if I were just to stick with what is trauma-informed language, I would say it's, again, and I'm actually quoting the U.S. Surgeon General. I was so honored to listen to him on it was a On Being podcast, and he talked about moving away from a fear-based system toward of medical care,
right.
So a fear-based system to a system based on love. And what would that?
And when was that, Kimberly? When did?
Last week. Yeah.
Oh, I love it.
So
I love
reframing the medical system, and what would that look like? Well, let's just say that trauma-informed language is about equalizing, and I will say one of my favorites is, instead of saying, I'm going to call you out on your stuff, I'm calling you out.
Right.
How about let's call you in?
There's a perfect example, right?
What is wrong with you? Why don't you just ... stop smoking, stop whatever. What's wrong with you?
Right.
Versus, I wonder what happened to you. What's right with you? Let's start with that.
Perfect.
Instead of this sort of American thing of like, well, people just make bad choices, They have the ability to make better choices. And I would argue, people who don't feel safe are not going to be, they won't be able to do safe things. They will do unsafe things for themselves and for other people.
Right, they're not looking at the scenario through the same lens. I mean, it's so shaded, and that's the unfortunate part. They think they're doing the right thing given what they know.
Right, right. And I believe that either you're coming from a place of love or you're coming from a place of fear. And if you're coming from a place of anger and envy and jealousy and frustration and confusion, and it's not a place of love. Everything else is coming from a place of love. If you're coming from a place of equality and deep respect and reverence.
Yes.
Reverence.
Absolutely.
For the fact that all life on earth is sacred.
So what would be, and I know we had talked about this, but what would be some words that come to mind for you as far as the culture and the vibe that people would feel walking into your clinic after February, and really what does 2022 look like as far as that sensation that somebody gets the minute they walk through the door?
I have so many words that I hope will come out.
Good.
I hope that people will feel a sense of belonging, that they belong there, that they are connected, that people care about them, that they don't have to fight so hard to fight for their health, that we got this, that we care about you, I'm an advocate for you, and let me hold some of that for you.
Oh, yeah. What a relief that must be.
Yeah.
Compared to, butting their head for years of,
Right.
pushing it down and not even expressing it, number one, just to put it out there.
Just being blamed.
Yes,
Being blamed.
yes.
Like, I don't see why you can't just stop doing this thing,
Right.
And that's what our culture is saying. So, I mean, I think when I look at the movement that occurred as a result of this research from 30 years ago, the educational system is way ahead of the medical system, and the complementary health world is also way ahead of the medical system in understanding this, as is the mental health system to some degree. But what I think we've been missing is the medical piece, to try to say, you know what, this is legitimate, this is a science, this is important, we need to learn this stuff.
Okay, so this is the perfect segue into what I find to be the most intriguing part of impacting those outcomes in the future. My career for 38 years was in healthcare wellness, and so when I heard this, I could not have been just more thrilled, because I tried to move in this direction for so many years. But to bring an insurance company on board, and I want you to be the one that gets to announce it,
yes.
because insurance companies for years rely on you being sick. They make
right.
money by people with illnesses and chronic disease not getting better in preventative care, so that healthcare costs go down, and that's where things can be shifted. You say profit, nonprofit,
right.
It can all go to better benefits that are important. So you go ahead and take it away on insurance. We have a couple minutes left, so
yeah.
this is a wrap here.
It
so
is.
Go ahead.
I just found out today that, and I'm honored to say that Blue Cross Blue Shield is honored to be part of the project of creating, and we're still trying to figure out what that looks like,
right.
But we are going to be partnering with Blue Cross Blue Shield to try to help create a new model, a new framework of trauma-informed providers, create a training program for medical providers, but also that training program will be able to be used in all the other sectors, education,
exactly,
healthcare.
Because it's about the staff as well. All the staff is trained, and then that in itself, you take that home, you take that out into the community. So it's
right.
Evolving everybody at that level. Not even, the patient's obviously the main concern in that setting, but again, it's coming from such a pure place.
And I just want to say that the most heavily traumatized people in our society are being locked behind bars. And we should be
Absolutely.
ashamed of ourselves. It is shameful. It is shameful.
Right.
And I'm disgusted.
Right.
And it's time to change the systems.
Yes.
And I hope that if we can establish a new way of creating the way we're going to practice medicine and reimburse for medicine, I hope and I pray that this will ripple out to the people that need it the most.
Absolutely. Let me just see, as I said, we have a couple minutes, so if there's anything that you're thinking of that I have not asked, I would love to have you just go right ahead. But, well, here's one last question, and then you take it to the end. But what can we do, starting right now, telling me to go out into the community and do something that will make it more kind? Is there something at that level just to be aware of? And I try, and I've certainly gotten better just knowing how Jen was about being kind, loving, caring, and sharing, and I try to do things a little differently. But what would you say would be a good takeaway to just say, when you see a person, blah, blah, do this? What comes to mind for you would be a kind act today?
I would say start with being kind to yourself.
Great point. Self-care.
Because if we don't, and self-care is all great and good, but we need to do self-care together. We
Yes.
need to create a culture where we're able to, sing together. And I will tell you, through this whole project, didn't expect to find that I was healing myself.
Absolutely.
And the way I healed myself was through being in a gospel choir. And I'll give a little pitch here for the Montpelier Community Gospel Choir.
Beautiful.
We're a perfect microcosm of people coming together from all different traditions.
Well, and what allowed you to take that step? Why did you do that for yourself?
Why?
How did that happen?
Because I knew I wanted to be able to speak about this project, and I was afraid of public speaking.
Right. Well, look at you go, girl.
So I started singing.
Love it. Good
and
for
then
you.
what that allowed me is to actually take the next step and then be involved with something called playback theater. Central Vermont Playback Theater is another way of helping people heal through storytelling and drama and using metaphor. And so it is through those two things, and also getting outside. I would say if there's one thing you can do to take care of yourself, it would be get outside and connect with nature in some way, because we have to save the earth. We're living in a catastrophe. Racism is a national health emergency. We have to change the way we're thinking about everything.
I agree, and I have to say, when we first talked, and you had mentioned that, I'm paraphrasing here a bit, but basically you were going to save the world. I'm thinking, okay, I gotta love it. I'm wide open. But then when I listened, you are going to change the world, Kimberly.
Well, all I know, I'm not an expert in trauma. All I know is that I've interviewed over 1,000 people now at the health center, and I see what an incredible impact it can make on one person. And I've seen the impact in one life, and then you times that by 1,000, and I just dream of a day when everyone will have access to this kind of important conversation with somebody who's taking care of them,
right,
who understands them, who understands them fully, and doesn't look down on them.
Correct.
Yeah.
Right. And thank you so much for all that you and your colleagues are doing in the central Vermont area. It's remarkable. It's remarkable. And we hopefully will be able to follow up. I would love that if you're willing to come back, and certainly keep track of 2022. Things are happening in February, so that gives you a lot of time to have some great results and outcomes so quickly. Having an insurance company on board makes all the difference in the world as far as being able to, really get to the right place where laws are changed and policies are put in place and protocols are adjusted.
So. And until those laws and policies are going to be put in place, I'm going to continue to put a lot of energy into the Vermont Kindness Project, which we do have a website, thanks to my genius niece, who got this together. And what it is
what is the address for your website?
The VermontKindnessProject.org.
Okay, and is Vermont spelled out?
Vermont is spelled out.
Okay,
yes.
good.
And there's some resources. There's TED Talks. There's people that have been really inspirational to me. Nadine Burke-Harris being one of them, and Bezel van der Kolk, Dr. Hudziak. There's so many people that have stepped into this path of this project that we've been starting, and now every time I need something else, like Jan Reardon calls me up. So it's awesome.
Thank you. It gives me chills. It does on so many levels, and I better obviously wrap this up, but I am looking forward to having you back here, Kimberly, and obviously staying in touch. And Jennifer, and I know your close friend is Carolyn. We're instrumental in having this all come together, and we have to definitely have to have some kudos go out there. But I just wanted to say that this show is something that I'm just so passionate about, and I am wide open to people letting me know if you have someone that I could interview where you feel as though a topic would be appropriate. Again, I really want to stay connected to Jen's 4 pillars, but her mantra of being kind, loving, caring, and sharing applies to everybody of every age, of every race, of every nationality. So it's time to put that out there as much as we possibly can, and any reinforcement on the importance of that, no less in your case, true evidence-based programming is where it is to, I think, get people to, really see where this is going and take
overpower
it seriously.
The bad news.
Exactly.
There's a lot of really amazing things going on.
There is so much.
And we don't talk about it.
So
having a place, the third Thursday, everybody can get on.
Third Thursday of every month at noon.
It's awesome.
Exactly.
I love it.
It's a great start, and shout out to Town Meeting TV to really understand the importance of being able to do this, because years ago, certain forms of media would never have even considered it. So the fact that now it's something that we know has to be a part of our community, it really will make a difference and transform life as we know it.
I hope so.
Yes.
Yay.
So thanks again. Yay. This is fabulous. Okay. Thank you.
Thank you.